Okay, so this video is going to focus on the pectoral girdle and the upper extremity. So you're going to have your handouts for both of those for today. So let us focus first on the pectoral girdle. The pectoral girdle means the connection of the shoulder to the upper arm. So think of your pecs. Your pec muscles are here, pectoralis muscle, pectoral girdle. So let's look at the two bones that make up the pectoral girdle. The first one we're going to look at is the clavicle. So the clavicle, as you all know, is called the collarbone in layman's terms. And then the second bone is going to be the scapula. So the clavicle and the scapula comprise the pectoral girdle. So first we're going to look down here at the clavicle. The clavicle has a thin end and a fat end. It also has kind of an S shape to it. So this happens to be the left clavicle. I don't have the right one with me, so we're going to look at the left one first, even though all the other bones are going to be the right side. So the left one, I'm going to bring it back up to this guy here, and we're going to put it up against the clavicle that is already articulated, so that it kind of gives you an idea of how it sits in the body. So as we bring it back down here, we see it has a flat end and a fat end. The flat end is the end that goes out towards lateral, and it goes towards the scapula. It articulates with the scapula. The fat end is going to be the end that articulates with the sternum. So let's bring it back up here again. So this end, which is going to be the thin end or the flatter end, is called the acromial end, because it articulates with this process on the scapula called the acromion. So the acromial end and the acromion go together. This end, which is the fatter end, is going to be called the sternal end. Why? Because it articulates with the sternum. So let's bring it back down, and we'll see we have the acromial end and the sternal end. And then one other thing to look at is this bump. This bump should always be inferior, so it should be on the bottom, and it should be towards the back, okay? So towards his back and on the bottom. So that is called the conoid tubercle. So conoid means cone-shaped. So imagine you had an ice cream cone and you just flopped it right on there. So that is the conoid tubercle, okay? Next we're gonna move on to the scapula. So the scapula is kind of hard for students to figure out sometimes because you can't actually see it on yourself because it is on the back. So this is the right scapula, okay? So it is going to have a really bumpy side, and it's going to have a smooth side. So as we come back down here, the smooth side is the side that fits up against the rib cage. So it has a little indentation there to kind of accommodate a rib. And then this side, which has the big bump on it, that is going to be the posterior side. So now let's look at our handout, and we'll start going down the list. So what we refer to here as this big bump on the back, that is called the spine of the scapula. Now above and below the spine, we have two depressions. So remember, your word for depression is fossa. And then the word for above is supra, and the word for below is infra. So this is going to be our supraspinous fossa. Supra above, spinous the spine, fossa depression. Down here is going to be our infrascapular, okay, let me start over. It's going to be our subscapular fossa. Sub means below, spinous means the spine, and fossa means our depression. So we have the spine, we have the supraspinous fossa, and we have the infraspinous fossa. Flip him over, and we have a depression on the anterior side. Remember, this is anterior. If you look through his rib cage, this is what you would see, and this is called the subscapular fossa. So this sub means below, so it's kind of below the scapula, even though it is anterior. Okay, now let us name these guys sticking out here. So this first one is going to be called the acromion. The acromion is what is connected with the acromial end of the clavicle. Then we have this guy here, which is called the coracoid process. Coracoid means beak-like, so imagine this as a bird beak. and this would be the coracoid process, acromion coracoid process. Next on your list are going to be the two borders. So the border, which is where all the things hanging out are, is going to be the axillary border. So I'll bring it back up here again, okay? The axillary border is called that because it is up against the armpit. And remember, armpit is the axilla, right? Then this border is going to be called the vertebral border because it is adjacent to the vertebrae. So we have the axillary border, which is lateral, armpit. We have the vertebral border, which is medial, vertebrae. Okay? So that is your scapula. And then we have this depression right here is called the glenoid cavity. The glenoid cavity is the socket part of the ball and socket joint. This is where the head of the humerus fits in. So this is where the arm hangs out, okay? So it always has to be lateral. It has to be lateral because the head of the humerus has to fit into that. Okay, now we're going to flip the page and we're going to go over and look at the humerus. Okay, so this is going to be a right humerus. So the right humerus, we know it's the right humerus for a couple of different ways. One way is that this is the head of the humerus. The head of the humerus always has to be medial. It has to go towards the inside of your arm. Then if we look down here, we see some nice smooth areas. Those have to be in the front. So those have to be anterior. So if this is medial and this is anterior, this makes this the right humerus. So let's start naming the parts of the humerus. We already mentioned head. So head is the ball part of the ball and socket joint. Then we have two necks for the humerus. One neck is going to be this line that you see going all the way around the head, okay? That is called the anatomical neck. Next we have the surgical neck. The surgical neck would be right about here. The surgical neck is called the surgical neck because if the patient has to have an amputation, they would typically try to do their amputation at this place. That allows a prosthetic device to attach to that area so that there is a stump there for the device to attach. So that would be the surgical neck. Now if we come back up and look at the top again, we see these two projections. These are called tubercles. Tubercles are things that kind of stick out. So the big one is called the greater tubercle. That is going to be the point of your shoulder. So that's what you can feel on yourself as the point of your shoulder. It is lateral. This one is called the lesser tubercle. So this is going to be anterior. That is going to be in the front. Okay, now let us go down to the bottom. So kind of draw a line now, and everything, all the terminology below what we just talked about is going to be on the distal end of the humerus. So we're going to look down here and we can see a fossa here and a fossa here, and then two items here. So that is what we're going to start looking at. So this first tiny fossa, which is lateral, is going to be the radial fossa. Okay, so the radial fossa. As we go over, the deeper depression is going to be called the coronoid fossa. So radial fossa, coronoid fossa. Okay, now I'm going to kind of put these other bones with it so we can start to put that terminology together. So this is the radius, and when the radius bends, the head of the radius goes into the radial fossa. This is the ulna, and this is called the coronoid process of the ulna, which we'll get to soon. But when you flex your elbow, then that goes into the coronoid fossa. So it starts to kind of make sense as to why it's named that. So if we go back down to these two projections here, this nice smooth one that kind of looks like a marble, that's called the capitulum. So capitulum means head, and radius again here, this is the head of the radius. So the head of the radius comes up against the capitulum, okay? So head of radius on the head, which is called the capitulum, okay? Then we have this section from here to here, so from one finger to the other, has a little dip in it. That's called the trochlea. So the trochlea means spool, so it kind of looks like an old-fashioned wooden spool, thread spool, right? So this is going to accommodate the trochlear notch of the ulna. So again, all named for things that they articulate with. Okay, so let's review those again. Radial fossa, coronoid fossa, capitulum, trochlea. And the last two terminology words on your list are going to be the epicondyles. Epi means to the side of. So we have the lateral epicondyle, small, and then we have the medial epicondyle, which is bigger. When in doubt, kind of glance up at the head because the head is medial, so the medial epicondyle has to be under the head. Okay? And then very last is the olecranon fossa. Whoop, gotta flip him over because the olecranon fossa is where your elbow fits in, and olecranon means elbow. So this is where your elbow fits in. Okay, so the point of your elbow would kind of fit into there. So it is the large depression on the posterior view of your humerus. Okay, so let us review them. Let's start at the top and just fly through them again. So we have the head, anatomical neck, surgical neck, greater tubercle, lesser tubercle. Down here we have the radial fossa, we have the coronoid fossa, we have the capitulum, trochlea, lateral epicondyle, medial epicondyle, and the olecranon fossa. Okay, now we have the radius and the ulna. Okay, so the radius is always going to be thumb side. Okay, so I'm going to hold it up to me. So the radius is thumb side, and the olecranon is pinky side. So remember your correct anatomical terminology or position where your palm has to be at. So radius and ulna. All right, so let's look at our radius next. So the radius is pretty simple. It has three parts on it that we need to know. So we have the head of the radius. Okay, so the head of the radius, remember, articulates with our capitulum. Okay. Next we have the styloid process. The styloid process is the lowest part of the distal end of the radius, styloid process. And then we have the ulnar notch. The ulnar notch is going to be on the medial side of the radius, and it's called the ulnar notch because guess who fits in there? The ulna. So the ulna articulates with the ulnar notch. Okay, so let's put the radius here so that we can kind of see it as it would fit. Next we're going to come back to the ulna. Okay, so the ulna is pinky side. It is the medial bone in your forearm. Your forearm has the two bones, radius and ulna. So up here at the very top, it's going to be the olecranon. The olecranon is the point of your elbow. That's what you can feel when you bend your elbow and you feel the point of your elbow. So that is the olecranon. Next we have the coronoid process. The coronoid process is distal to the olecranon. In between those, you see a carved out area that is called the trochlear notch. So the trochlear notch, remember, slides on your trochlea of the humerus. Okay, so olecranon, coronoid process, trochlear notch. And then down at the end, we have another styloid process. So the styloid process is going to be the lowest part of the radius of the ulna, just like the styloid process was the lowest part of the radius. Styloid process, okay? And then up here again, we have the ulnar, or the radial notch. So the radial notch is called the radial notch because who do you think fits in there? Radius. So radius fits in the radial notch, okay? So I'm going to go through these again. So we're going to keep them together with our humerus so that we can get kind of a bird's eye view of what it looks like. Okay, so radius, head. Head because it fits on the capitulum of the humerus. Next is the styloid process down below. And over here we have the ulnar notch. All right, let's look at our ulna. Now remember, in the skeleton and in life, it would sit like this, okay? So let's pull it off for a minute so we can look at its parts. So this is going to be the olecranon. We have the coronoid process, and then we have the scooped out trochlear notch. Okay, then down below we're going to have the styloid process again. oops, and flip back up here, we now have the radial notch because that's where the radius fits in. So this is how this would fit all together in the skeleton. So if you come up to the skeleton, I'll show you again that we have the humerus, radius, and ulna. So those are what allow you to bend your elbow, flex and extend your elbow. Now if you see here in between these two, there's a big hole there. In real life, there's really not a big hole. It's filled in with something called the interosseous membrane. So the interosseous membrane is the connective tissue that holds those two together so that they don't swivel around each other like that and rotate around. Okay, so next we're going to go on to the hand. So the hand is going to be palm up, and remember the terminology for that is the supine position. So the supine position up, supes on your hand, supes up, okay? So let us look at this. So now we have the wrist, we have the metacarpals, and we have the digits. So the wrist is called the carpus. So from now on, we're going to refer to the wrist as the carpus, okay? They are composed of 8 carpal bones. So we have 1, 2, 3, 4, 5, 6, 7, 8. 8 carpal bones. Okay, so let's look at those first. So the top row is called the proximal row. Proximal row, we always start with the thumb and work our way over. So we start lateral and work our way over. So this one is going to be the scaphoid. Then we have the lunate. Then we have the triquetrum. And then this little spinner guy here is called the pisiform. So pisiform means P-shaped, so it kind of is a little bit of a P shape. Scaphoid actually means ship, like a ship. So you might imagine that as being a little curved like a ship, okay? And then lunate means moon. Use your imagination. Does that look like a moon? And then we have a triquetrum, which means 3 points, and pisiform, which means P-shaped, okay? Now we zip back over and we start with the thumb again, and now we're looking at these 4 down on the distal row. So the first one is called the trapezium. Then we have the trapezoid. Then we have the capitate. The capitate is the largest one in the bottom row, in the distal row. Again, it has the word cap in it, which means head. I don't know whose head looks like that, but that is called the capitate. And then this one, which can you see on the video, has a hook on it. So that's called the hamate. So the hamate is the one that has a little hook on it. So let's start again. So we have scaphoid, lunate, triquetrum, pisiform. And then over we have trapezium, trapezoid, capitate, and hamate. So those are going to be the bones of your wrist or your carpus. Next we have the metacarpals, so not a whole lot to them. Metacarpals, meta means in between, so meta is in between the carpus and the fingers, the digits. So they're pretty easy, they're just numbered 1, 2, 3, 4, 5. We have to use Roman numerals, so this would be Roman numeral 1, so metacarpal 1, metacarpal 2, 3, 4, 5. So in the hand we start lateral and work over to medial. So we start with our thumb and work our way over. Remember, thumb's number 1, so that would be 1. Now we have our digits. So the digits are composed of bones called phalanges. So the singular form of phalanges is phalanx. It's kind of confusing. So this is a phalanx, this is a phalanx, this is a phalanx. All 3 of these are phalanges. So the digits have phalanges. Your thumb only has 2 phalanges, okay? You have 1 knuckle there. Your other fingers have 3 phalanges. So let's, again, pretty easy to determine. So remember, we're going from up here to down. So this is going to be your proximal phalanx, your middle phalanx, and your distal phalanx. Mr. Thumb only has 2, so it only has a proximal and a distal phalanx. Now your fingers are digits, digits 1, digit 2, digit 3, digit 4, digit 5. So again, we start with our thumb and we work our way over. So let's have a little example. So if I said, what is this bone? You're going to tell me it's the proximal phalanx of digit 3. If I say name this bone, you're going to say it is the middle phalanx of digit 5. Okay, if I say name this bone, this is the distal phalanx of digit 1. So again, we have the carpus, the metacarpals, and the digits, which are comprised of all of the phalanges. Okay, so that is the ending for our pectoral girdle and upper extremity.